Good afternoon. I am Dr. Chirayu from Gujarat. I will be talking about agonist protocol. So agonist protocol, also we can call it long protocol. We start from previous cycle. So this is previous cycle. We give them OC pills from day 5. Continue till day 20, which will be continued till day 26. This is COCPs. Again we call the patient on day 21 and we start her on an agonist, Leupride for example 1 milligram per ml. We give her 10 doses and ask her to take the drugs every day and same time. And we give her 10 doses and we ask them to come back after the doses are completed, irrespective of whether she gets the period or whether she does not get the period. So you can also coast it up to 20 days if you are on a holiday or something. When the patient comes back, so if the patient has not got the periods, you have to check the UPT. If it is negative or if the patient gets the period, then you start her stimulation with gonadotropins, whichever you like, or based on age, AMH and all, and you decrease the dose of Leupride or agonist, whichever you give, to half. So half dose Leupride. And you continue till 10-12 days till 75% of the follicles are more than 20 mm. And then you give on the day of trigger, you give trigger. The trigger will be always HCG trigger. So HCG will have a long half-life, so it will increase the chances of OHSS, so be careful. And that is the reason of the unpopularity of this protocol as compared to antagonist, where number of injections are also less. And since we are giving their agonist protocol, agonist trigger, the chances of OHSS are also less. But you can use this in batch if you are doing batch IVFs, and also it is coming back for patients who have like severe adenomyosis or in failed antagonist cycles. You can use. Okay, thank you. Any questions?
Yeah, this is Dr. Namrata Sirmar from Raipur. If she doesn't get period and her UPT is negative, then how you will proceed?
If she doesn't get her period, if she doesn't get her period and UPT is negative, then you do the USG. In USG, ovaries will be silent, ET will be normal. You can also do ET and E2 and LH. E2 will be less than 25, LH will be less than 5. Then everything is normal and you start the stimulation.
And which agonist trigger? Why we should not use agonist trigger in this particular?
Yes, we have done suppression. Down regulation, pituitary down regulation. So there is no FSH and LH in the pituitary. So if agonist will actually give the flare, because we use agonist trigger because it will give the flare, right? The initial flare. But here, since the pituitary is empty, there will be no flare. So instead we give HCG, and that is the reason.